Hi students, a warm welcome to one and all. I am Dr. Suresh, Assistant Professor from the Department of Conservative Dentistry and Endodontics, Vinayaga Mission Sankaracharya Dental College, Salem. Today we are going to discuss about endodontic irrigant mishaps. To introduce, the clinical endodontic encompasses a number of treatments, but they have in common of goal to prevent and treating the microbial contamination of the root canal systems. So, in order to eliminate or significant reduction of irritants and prevention of recontamination of the root canal after treatment are the very essential elements for the successful outcome of the root canal treatment. So, although the term cleaning and shaping are commonly often used in our daily day-to-day practice, I prefer reversing the order of cleaning and shaping into shaping and cleaning, which I feel more correctly than cleaning and shaping because it correctly reflects the fact that enlarged canals direct and facilitate the cleaning action of the irrigant and removal of the infected dentin. So the main two objectives of the cleaning and shaping of root canal systems are, one is mechanical objective, the next one is the biological objective. The mechanical objective should be able to complete and centered incorporation of the original canals into the prepared shape. The next one is the biological objective. It is the most important one, and in the biological objective of cleaning and shaping is to disinfect optimally through the removal of infected pulp, dentin, and creation of the space for the delivery of irrigant solution into the root canal space. So the main action of irrigants can enhance the mechanical debridement through the flushing out of the debris and also the dissolving the organic tissues and disinfect the root canal system. So the complex anatomical structures such as lateral canals, axillary canals, which are not able to clean through our endodontic files. So in complex internal anatomy such as fins or other irregularities such as the lateral canals, axillary canals, apical delta region that might be missed by the instrumentation can be treated by the chemical debridement such as the irrigant solution. So coming to the classification of irrigants, the commonly used irrigant solution are classified into chlorine releasing agents such as potassium hypochlorite, sodium hypochlorite, in which the sodium hypochlorite is the gold standard irrigant solution which are used in the endodontic purpose. Next, coming to the oxidizing agents, which consists of hydrogen peroxide and urea peroxide, and the chelating agents such as EDTA and EDTA combination with the cetrimide. Why the cetrimide is combination? Because it can able to reduce the surface tension of the root canal walls and enhancing the irrigating solution to completely enter into the root canal space causes the complete debridement of the debris. Next one is the organic acid such as citric acid and malic acids can be used as an irrigant solution. Next one is a herbal alternative such as green tea, triphala are also used as an irrigant solution. Ideal requirements of irrigants are mainly effective germicide and fungicide of the solution. It should be non-irritant to the periapical tissue when extruded during the irrigation procedure, and it should remain stable in the solution. And it's also mainly active in the presence of blood, serum, and protein derivatives of the tissues. It should have low surface tension because the surface tension play an important role in reaching the lateral canals and axillary canals. So the irrigant should have composed so low surface tension in order to completely reach the minor complex anatomical regions, and it should not induce any immune response to the individual. It should completely remove the smear layer and disinfect the dentin and its dentinal tubules. There should be no adverse effects on its physical properties of the exposed dentin. And the main and the final ideal requirements of the irrigants such as it should not stain the tooth structure. So coming to the functions of the irrigants, so the main function of the irrigant solution is to removal of the particulate debris and wetting of the canal walls. So the complete wetting and the low surface tension are the main two components which can use a irrigant solution to completely enter into the complex anatomical regions such as lateral canals and the axillary canals. The other functions are destruction of the microorganisms in the root canal space, dissolution of the organic debris that is the pulpal tissue on the complex anatomical regions, and the opening of dentinal tubules by removal of the smear layer. In case of any resin sealer used, the removal of smear layer is mainly important for the complete bonding of the resin sealer into the root canal spaces. So next one is the disinfection and cleaning of areas which are inaccessible to the endodontic instruments such as endodontic files. Next one is the related incidence to the irrigant solution. The most common related incidence is the extrusion of the irrigant solution into the periapical tissue, which is mainly caused by the sodium hypochlorite. Next one is the air emphysema and crepitus. The air emphysema is nothing but the forceful air injection into the subcutaneous tissue either due to the root canal space or use of the irrigant solution such as hydrogen peroxide, may sometimes called air emphysema in dentistry, and crepitus is not common but also sometimes caused in the dental practices. The next common related incident is the hypersensitivity reaction. So some individuals have hypersensitivity reactions to the chlorine present in the sodium hypochlorite, which mainly cause the type 4 hypersensitivity reaction. So the main causative factors for the endodontic related irrigant mishaps are open apices, which is completely formed root apexes due to the caries formation in the young age or due to the traumatic tooth. Next one is the inaccurate working length determination, which may be due to over instrumentation or inaccurate working length determination procedures such as non-radiographic method, and improper radiographic techniques can also be cause inaccurate working length determination. Next common cause is the perforations, which mainly due to the focal perforation or strip perforations in the MB canal of mandibular molars. The other causative factors for the extrusion of irrigant solutions is maybe vertical root fracture of the root and also due to the lateral perforations. So the main endodontic irrigant mishaps in our day-to-day practice, which clinicians and practitioners face, is that sodium hypochlorite accident. Sodium hypochlorite is the gold standard irrigant solution which we are used to commonly now. Its concentration will range from 0.5% to the 6%. For endodontic percentage, the most commonly used percentage are 3% and 5%. So the sodium hypochlorite accident is one of the major accident we are facing daily, day to day, or commonly facing sodium hypochlorite accident in a clinician practitioners. So the main reason for the sodium hypochlorite accident is that because of its excellent tissue dissolution property and its antimicrobial property, because of its increased pH, that is pH of about 11, which cause excellent tissue dissolution property, which cause necrosis of the periapical tissue when extruded beyond the root canal spaces. So the risk factors for the sodium hypochlorite accidents, which first includes the needle wedging. The wedging of needle into the root canal space, which mainly causes the extrusion of the irrigant solution into the periapical region, because it causes the active irrigation into the root canal space instead of the passive irrigation. Usually we will prefer passive irrigation of irrigant solution into the root canal space, that is by avoiding the wedging of needle into the root canal space. Next one is the open apices, which we have already seen because of caries formation in the young age or due to the traumatic tooth or any disorders which causes the open apexes of the tooth. Next one is the structural approximation, which we commonly seen in the maxillary molars, which will be commonly approximated to the maxillary sinus. So in such cases, the extrusion of irrigant solution into the maxillary sinus can cause severe inflammation and the inflammation of the infection of the maxillary sinus. Next one is the incidence and distribution of the sodium hypochlorite accident, which was given by Sarhan et al. In 2016. He said that maxilla is more commonly affected than the mandible. So the reason behind that the maxilla was more commonly affected was the thickness of the cortical bone when compared to the mandible. Maxilla have less cortical thickness bone density, so it can be easily extruded into the root canal space into the periapical tissue, so it can cause more common than the mandible. In compared to the tooth region, incisor and canine are less commonly infected than the molar and premolar, which are more commonly related to the sodium hypochlorite accident because of its larger canal over instrumentation, and the bone thickness can also vary for this. Next one is females are more commonly affected than the males. So how will we recognize that sodium hypochlorite incident or extrusion are happen in our clinical situations? The first major symptoms which explained by the patient is a severe pain exhibiting at the periapical region while doing the irrigation with the hypochlorite. So with use of triad of symptoms like pain, diffuse swelling at the extruder region and profuse bleeding from the root canal spaces are the main triad of symptoms which can be used to recognize the sodium hypochlorite extrusion in the root canal space. So with the help of this diagram, I am depicting there is a 2 points. First one is the tragus of the ear. There are 2 lines which drawn from the tragus of the ear. From the tragus of the ear, there is a line drawn to corner of the mouth. From the tragus of the ear, which can drain from to the Pogonian point. By using the 2 lines and also the another line which started from the angle of the mandible to the lateral canthus of the eye, angle of the mandible to the ala of the nose, angle of the mandible to the corner of the mouth, angle of the mandible to the Pogonian. By using the help of these 6 points, we can estimate the amount of diffuse swelling formed after the extrusion of the sodium hypochlorite accident, and also the amount of extrusion can also be approximately calculated with the amount of swelling formed after the extrusion of the sodium hypochlorite. So the next one is the assessment of the severity, because the assessment should be mainly needed for the proper management of the sodium hypochlorite accident. So the severity assessment starts with degree of pain, followed by the extraoral examination, followed by the intraoral examination, and finally the airway assessment. So the degree of pain is finally calculated with the help of the pain scale, which ranges from 0 to 10, The 0 is no distress of the symptoms, and finally the 10 is the unbearable stresses. So the patient have minor extrusion of the sodium hypochlorite, have none of the symptoms, starting with annoying of the pain 2 scale, and uncomfortable in pain 4 scale, and dreadful in pain 6 scale, and horrible in pain 8 scale, and agonizing pain they have facing towards the more extrusion of the sodium hypochlorite, which ranges from pain 10 scale. Next one is the extraoral examination of the sodium hypochlorite accident. In extraoral examination, before I already explained, with the help of the 2 line from the tragus of the ear to corner of the mouth and Pogonian point, and also the angle of mandible to the 4 points such as lateral canthus of the eye, ala of the nose, corner of the mouth, and also to the Pogonian point. With the help of these points, the extraoral swelling can be determined, which is the sequence of extraoral swelling decreases after the sodium hypochlorite management. So in intraoral, the intraoral we are commonly used to the profuse bleeding from the root canal space, which I have prepared already, and also to the bruising and necrosis of the affected region, mainly on the sulcus region on the affected teeth. So it ultimately causes the deep mucosal ulceration and necrosis of the periapical tissue, and which ultimately results in the mucosal ulceration. So the final one is the assessment of the airway. Because of more extrusion of the sodium hypochlorite into the periapical tissue, Zhu et al. Classified into the 4 main regions. Based on this, the assessment can be made. First one is the periorbital region, which is mild causes of the sodium hypochlorite accident. Next one is the which extend into the lateral border of the nose. Third one is the which extend into the neck region, and final one is the chest region. So while the sodium hypochlorite incident causing the necrosis, when it reaches the neck region, it ultimately causes the Ludwig's angina, which causes airway obstruction, which ultimately leads into the more serious complication than the normal. So the first airway assessment includes the edema, which I want to find out with the help of that scale how much the edema is extended and how the region of extension should be. Next one is the hoarseness and coughing of the patients. Next one is the stridor, that is the obstruction of the airway obstruction during the formation of the Ludwig's angina. If the stridor is facing towards the patient, the patient should be immediately referred into the physician, and the sufficient procedure should be made to avoid the further complications. So based on the symptoms which you have seen from the pain scale, extraoral swelling, intraoral swelling, and the airway assessment, the symptoms are classified into mild, moderate, and severe. So in mild, the pain scale should be ranged from 0 to 3, and the swelling, while using the 2 points, the calculation should be made. It should be extent less than 30%, and ecchymosis is localized, and the other symptoms, which includes no intraoral ulceration and no intraoral necrosis, should be seen. So it should be mainly managed by the endodontist itself. No other consultation are needed in the mild symptoms cases. So in moderate cases, the pain scale will range from 4 to 6, almost an distress pain symptoms, and the swelling ranges from 30 to 50% of the face, and ecchymosis is the diffuse ecchymosis seen on the intraoral region, and other investigations are seen as intraoral ulcerations. So in such moderate sodium hypochlorite incident accident, we are definitely need an opinion from the oral and maxillofacial surgeons and other specialties. So in severe cases, the pain score will almost reach the agonizing pain, that is the pain score 10. The swelling has more than 50% of the face, diffuse swelling on the intraoral and extraoral region, ecchymosis also seen. The other symptoms are seen as intraoral ulcerations, intraoral necrosis, airway compromise, sometimes called Ludwig's angina, and stridor may also happen. Neurovascular deficit can also happen. In such cases, the definite opinion and management of oral and maxillofacial surgeons are also needed. Coming to the management of sodium hypochlorite accident, the first thing is to explain the procedure or mishaps to the patient and make sure that the patient should be calm and reassure the patient that it will be completely alright once the symptoms are relieved. Next one is the documentation of the mishaps happened for the further procedure and also to the medico-legal complications. Next one is the conservative and palliative management for the better healing and the completeness of the procedure. Coming to the clinical guidelines, which was given by WITS Oral Health Center, immediately following extrusion, the first thing is the clinician should follow is the aspiration of small amount of sodium hypochlorite, which will leave on the root canal space due to the tension we have during that procedure. The aspiration of sodium hypochlorite in the root canal space will prevent the further increase in the symptoms of the patient exhibited. Next one is giving the local anesthesia at the specific region in order to relieve the patient's pain, followed by copious amount of saline irrigation into the root canal space, even if it into the periapical region, can neutralize the pH of the sodium hypochlorite, so and also will decrease in the symptoms which will exhibited by the sodium hypochlorite. Then followed by the antibiotics and analgesics. The antibiotics will help in reducing the amount of infection present on the periapical region, and analgesics will mainly help in relieving the pain of the patients. Next, coming to the OMFS and cold pack, when it is needed, there is a definite opinion management from the surgeons, oral and maxillofacial surgeons, and followed by the cold pack in order to reduce the burning sensation for the patient and also reduce the inflammation for the first 24 hours to 48 hours. So it should be followed by after 24 hours the clinical and sequel should be examined. Then after 28 to 24 hours to 48 hours, the patient should be advised for the warm packs and oral rinses in order to promote the blood circulation into the affected area, which will ultimately cause to the inflammatory reaction, and the healing procedure will start. Next, the clinical sequels and antibiotics should be continued for till 14 days. Then if needed, chlorhexidine mouthwash and other irrigants can be used after 24 hours. After 7th and 14 days, the clinical sequel, that is the ecchymosis, bruising, necrosis of the intraoral ulceration are examined. Amount of diffuse swelling or intraoral, extraoral swellings are also examined, which will determine the healing process of the sodium hypochlorite accident. And finally, alternate irrigants other than the sodium hypochlorite such as chlorhexidine, EDTA can also be used to complete the procedure. So this is a case report which was published in the Journal of Dentistry and Oral Sciences. In this case report, they have used low-level laser therapy as a co-adjuvant in sodium hypochlorite extrusion management. So this is a patient of age 79 years in which the canine doing root canal treatment, there is a sodium hypochlorite accident in which we can clearly see in the infraorbital region, lateral ala of the nose and the corner of the mouth are clearly infected because of the sodium hypochlorite accident. This is a frontal view and the lateral view of the patient. So the intraoral view also shown the bruising, necrosis of the upper lip region and the sulcus region. It mainly because of the sodium hypochlorite. So they have prescribed the steroids like dexamethasone 8 gram intramuscularly for 6 days. Because of the more involvement of the extraoral region and the intraoral region, they have prescribed the intramuscular dexamethasone, which is 8 gram for 6 days. Then they have used double antibiotic schemes such as clindamycin 300 milligram every 8 hours and ciprofloxacin 500 milligram every 8 hours. They are continued for 15 days. So in this case, they have used a proteolytic enzyme because mainly it can help in reducing the inflammatory process and also improves in the better healing properties. So the proteolytic enzymes such as bromelain, papain, trypsin and chymotrypsin, 4 tablets every 8 hours are used in this case report. So in order to reduce the inflammatory process and the healing process makes more faster, they have used low-level laser therapy such as gallium arsenide laser of 14,000 Hz, which are used as an adjuvant therapy other than the medications and prescriptions they have provided. So this is the low-level gallium arsenide laser. The patient should be properly protected with the protective glasses. The gallium arsenide laser should be always used in the circular motion every 3 days from the date of incident for 30 minutes till the healing gets subsided. So it should be used for the period of minutes of 3 to 5 minutes every 3rd day. So this is the patient after the 3rd day, there is a significant reduce in the inflammation and bruising reactions, and also the necrosis can also be decreased. After the 7 days of laser therapy, there is a significant decrease in the symptoms of the patient exhibited. After 13 days of laser therapy, there is a complete decrease of the symptoms the patient exhibited. Why they have preferred laser while using the many common prescribed medications? Because of the laser have better biomodulatory activity and also reduces the inflammatory process by deproteinization, by preventing the deproteinization of the tissues, which results in the amino acids formation, which further causes the cyclooxygenases pathway, which ultimately results in the inflammatory reactions. So finally, how can we prevent the sodium hypochlorite incident? The first main thing is to isolate the tooth properly with the rubber dam. Is the main first prevention for the sodium hypochlorite accident. Next one is to avoid needle wedging onto the root canal spaces. Next one is always prefer 2 mm short of the root canal apices in order to avoid the sodium hypochlorite accident. And also the final one is the use of side vented needles instead of the straight vented needles in order to direct extrusion of the sodium hypochlorite into the periapical region. So these are my references. Thank you for listening my class.